Hello friends, welcome to our YouTube channel Applied Veterinary Medicine. Today's topic for discussion is an animal disease named Bacillary Hemoglobinuria, also called red water disease, etiology caused by Clostridium hemolyticum, C. novi type D, a soil-borne anaerobic bacteria. The spores may survive long-term and are often present in the liver of healthy cattle in endemic areas. Liver damage, e.g., from liver flukes or necrobacillosis, creates anaerobic conditions for bacterial growth and beta toxin production, leading to disease. Epidemiology found globally, including in the US, UK, Australia, and India. Rare disease, but losses on infected farms can reach 25%. Risk factors: summer, autumn grazing, liver flukes, irrigated pastures, and stress caused by moving cattle into endemic areas. Pathogenesis: bacteria lodge in the liver and proliferate when anaerobic conditions arise, e.g., from liver necrosis, beta toxin causes hemolysis of red blood cells causing red urine. Liver necrosis, systemic toxemia and vascular damage. Anemic infarcts in the liver are characteristic. Clinical signs: onset and general signs, sudden onset. Infected animals often show no warning signs until symptoms emerge abruptly. Cattle at pasture may sometimes be found dead without apparent illness beforehand. Sudden cessation of rumination, feeding, lactation, and defecation. Behavioral and physical symptoms: abdominal pain, animals exhibit reluctance to move. They often stand in an arched back posture. Grunting can occur, especially while walking, indicating discomfort. Respiratory and circulatory issues: breathing becomes shallow and labored. The pulse is weak and rapid, suggesting cardiovascular strain. Fever: high temperatures 39.5 to 41 degrees Celsius or 103 to 106 degrees Fahrenheit in early stages. The temperature drops to subnormal as the disease progresses and before death. Urinary and fecal changes: dark red urine, hemoglobinuria, due to hemolysis, though no red blood cells are present in the urine. Feces, typically dark brown, may contain mucus and blood, or there could be diarrhea in some cases. Jaundice and edema: jaundice is often present, although it may not always be prominently visible. Swelling, edema, around the brisket region is common. Disease duration: rapid progression, can last from 12 hours in dairy cows, especially in advanced pregnancy, to 4 days in dry cattle. Pregnant cows often suffer abortions due to the illness. Terminal signs: in the final stages, severe dyspnea, difficulty in breathing becomes evident. Animals may succumb to the disease shortly after. Diagnosis: clinical signs: red urine without red blood cells, anemia, elevated liver enzymes, AST, GGT, bilirubin. Necropsy findings: pale liver infarcts with hyperemia zones, hemorrhages in tissues and organs, presence of beta toxin. Tests: fluorescent antibody test, FAT, confirms Clostridium novi type, but not subtype. PCR for toxin identification. Treatment antibiotic therapy, immediate administration of penicillin G, sodium, potassium, 15,000 U per kilogram IV every 6 to 8 hours. Oxytetracycline, 15 to 20 mg per kilogram IV every 24 hours. Supportive therapy: antitoxic serum, if available, highly effective if used early, can stop hemoglobinuria within 12 hours. Fluids and blood transfusion, restores hydration, corrects electrolyte imbalance, and combats anemia. Care during treatment: avoid excitement or exertion to prevent sudden death. Bulls should not be used for breeding for at least 3 weeks post-recovery. Prompt action is critical, as the disease progresses rapidly. Treatment should ideally start in the very early stages of clinical signs. Let me know if you'd like details on control or prevention strategies. Control annual vaccination with formalin-killed Clostridium hemolyticum bacteria, ideally 4 to 6 weeks before the disease season. Dispose of carcasses by burning or burial to prevent spread. Manage liver flukes and avoid pastures with infection risks. This should provide a concise yet comprehensive summary. If you'd like, I can focus more on a specific section. Thank you for watching this video.